name's Mani Berghout, and I'm an advanced trainee in geriatric medicine with Hunter New England Health. Today I'm going to talk a bit about delirium, what it is, what causes it, how you might recognise it, and what to do about it. So delirium is a sudden change in a person's mental state that's characterised by fluctuations in their attention and awareness. Things that cause it are commonly changes in medications, being unwell, such as having a urinary tract infection, or even withdrawal, like from alcohol. It can happen to anyone, and it's common, but it's more likely to happen in someone who's got cognitive impairment. Basically, what happens is it occurs when someone's cognitive capacity is overwhelmed. So a person with cognitive impairment has less reserve and could become overwhelmed by something as simple as constipation. A younger, robust person with normal cognition might need a really big insult to become delirious. Something like, for example, major surgery with a really long anaesthetic time. The sorts of things that increase your risk of becoming delirious include being on lots of different medications, having lots of chronic medical health problems, being sight or hearing impaired, and simply being older. So how might you recognise it? Well, there are two main types of delirium. The first is hyperactive delirium. You might see them plucking at their sheets, becoming restless and agitated. They might hallucinate or become paranoid and might start to wander or resist your care. This is usually fairly obvious because it's right there in your face. But the other type, hypoactive delirium, is when they become really unusually quiet and withdrawn. They might even seem a bit depressed or like they're in a daze. And this is much harder to recognise because they don't draw attention to themselves. Either way, they're both characterised by a recent sudden change in from their normal behaviour, and it fluctuates throughout the day. They can change backwards and forwards between these two types of delirium. It's really important to recognise when someone has delirium because it can lead to other problems like pressure sores or falls. And it can be really distressing to the patient and to the carer. And furthermore, it can actually contribute to their cognitive decline. So to treat delirium, first of all, seek medical care swiftly. Your doctor will help to try to work out the underlying cause of the delirium. They might want to know if they've had a change in their medications recently. Have they been really constipated? Have they had any illness recently? Are they in a lot of pain? Has there been some other recent change in their life that might have triggered the delirium? And then their treatment will focus on that underlying cause. But sometimes, even once the cause has been identified and is being appropriately treated, they're still delirious. And this is where your role as a carer is really important. There's a lot that you can do to help them to gently reorientate and recover. Make sure that they're in familiar surrounds with familiar company. Make sure they're wearing their hearing aids and their glasses. Give them a view of outside so they can see when it's night or day. Have a clock and calendar handy so they can see how time's passing. Maintain a normal, healthy sleep-wake cycle. Get them up in the morning. Keep them active by day and go to bed at a sensible time. Make sure they're eating and drinking well, their bowels are opening, and they're getting their medications on time. So how long does it take to recover? Well, unfortunately, there's no simple answer to that one. It's very individually variable. Some people, in fact, most people get better in a matter of days to weeks. There are some that take months, and then there's a small percentage who never fully recover back to how they were before they became sick. And unfortunately, it does potentially speed up their cognitive decline. And this is why it is so important that you seek medical help if you suspect that they've become delirious. So the take-home messages that I'd like you to remember from today's talk are, firstly, delirium is common. Secondly, suspect it if you see a sudden change in behaviour, particularly if it's fluctuating throughout the course of the day. Thirdly, seek medical help to figure out and treat the underlying cause. And finally, recovery can take weeks. Thank you for listening.